Good afternoon and thank you for joining us. My name is Tina Tebow and I will be your moderator for today's briefing. Joining us today, the Honourable Ian Rankin, Premier of the Province of Nova Scotia, Dr. Robert Strang, Chief Medical Officer of Health for Nova Scotia, and Dr. Brendan Carr, who is joining us via Zoom today. And Dr. Carr is the President and CEO of Nova Scotia Health. Go ahead, Premier.
Thank you, Tina. Today is another difficult day for our province. Unfortunately, I am reporting that there's been 2 deaths related to COVID-19 complications in our hospitals. This was 2 women in their 60s, one in the central zone and one in the eastern zone. So my thoughts and prayers are with those families. On behalf of all Nova Scotians, our condolences go out to the families. The news of these deaths is just another indicator of how serious the wave is that we're in right now. We are reporting 83 cases. Most continue to be in the Halifax area. Though the cases are coming down significantly, we are reporting 19 cases in the Cape Breton Regional Municipality. So that's an increase and they continue to climb. After much work on contact tracing, we know that there are a number of cases that we can't connect to an initial source. So we have to conclude that there is some community spread in Sydney. This is definitely a concern and we have to be able to contain this spread. So that's why we've increased testing in the Sydney and surrounding area, and I want to encourage everyone in that area and throughout the province to continue to go out and get tested. On the hospitalizations, I'll just say we do have 101 patients in hospital, and since we do have with us again Dr. Brendan Carr, he can give some more detail and of course afterwards take questions. So I'll turn it over to you, Dr. Carr.
Thank you, Premier, and let me also add my condolences to the families of those 2 Nova Scotians who have unfortunately died as a result of COVID-19. As you indicated, as of 10:30 this morning, we have 101 people in hospital with COVID, and 20 of those are in intensive care. Those numbers are down slightly from earlier totals, but essentially we still expect to see more patients admitted to hospital with COVID in this 3rd wave. About 3/4 of our current hospitalizations are in the central zone, and that means the central zone where the QE2 operates. The QE2 provides specialized services to the entire province, and the central zone has also been where we've had the majority of cases. So that's created quite a bit of pressure on the hospital in the central zone. To help manage that pressure, we've transferred a total of 8 patients from the central zone to other zones, and so this includes both COVID and non-COVID patients. This is really so that we can continue to have some capacity to deal with what we know are going to be additional COVID patients in both acute care and ICU, as well as to keep some of the critical programs that are going on every day going on at the QE2, our heart health program, our neurosurgery program, our cancer care program. So we regret having to transfer patients out of their home region for hospital care. We recognize that this is more than an inconvenience, that it's an additional stress for the patient and their families, and it's something that is necessary to do so that we can ensure that we have the right resources to deal with what we anticipate, and so that we can ensure that we can continue to provide specialized care for patients from all across the province. I'd also like to highlight the efforts of our COVID community virtual care team. They've been contacting Nova Scotians within hours of new positive test results to offer support and monitoring. This service is now partnered with EHS. And so where we are not able to contact a patient, EHS are going to step in and will attempt to make first contact with those patients. The other thing that I want to mention is that our partners at the IWK have a parallel program for younger Nova Scotians, and they have been essentially reaching out and looking after young Nova Scotians in the community along with us. We think that this is an important support for Nova Scotians with COVID. It provides us with very important information regarding how people are doing in the community as we monitor them. And in fact, it gives us a sense of how many patients may need hospitalization or further higher levels of care in the days to come. So we feel that it's a really good example of our responsiveness and us working together as a system. This virtual care work is in addition to the work of our public health teams, who are also contacting patients with new diagnosis of COVID. And in their case, the work that they're doing is critically important for us to understand how the disease is being spread, to understand contacts, to understand where we might be experiencing new outbreaks. So the work of our virtual care community support team does not replace the work of our public health team, and it's so important that people that they make themselves available and that they take the phone call from public health so that we can do our job to do the contact tracing, that we can understand the epidemiology, and people really should be following whatever guidance our public health teams give them through their contact tracing. So please do take the call from public health when you receive it. Regarding the outbreak at the non-COVID unit at the Halifax Infirmary, a total of 15 patients who have been in the unit have tested positive. 12 of those patients remain in hospital, and a total of 6 employees who have worked in that area have tested positive. As I mentioned the other day, we continue to investigate the source for this outbreak. There's nothing definitive yet. We have continued to do testing of our staff. We've retested all the patients on the unit, and we've done what we refer to as a point prevalence study, which is essentially testing all the patients at the QE2 Health Sciences Center, both the HI, the Victoria General, and we are going to extend that to the Dartmouth General this week. So we will be testing all of our patients essentially at a point in time to ensure that we understand the true prevalence, or how many people who truly have COVID in hospital. What I can say, since we started this work a couple of days ago, we have not turned up any further positive patients in the hospital since we started this work. All of our patients do get tested on admission to hospital, and in particular, patients who are coming in for procedures and surgical procedures have to be tested in advance of their surgeries. During our earlier waves, we were doing this within 72 hours of a procedure, but given the current risk level has been higher because of the variants and the amount of community spread, essentially testing is required within 24 hours of a procedure within the central zone and 48 hours within the other zones in the province. It doesn't change whether or not a patient can have surgery, but it does impact the protocols and the approaches that our surgical teams will take when they're managing a patient who they know has COVID. Much of the other important work that we're doing as an organization carries on, and I would also like to highlight the Virtual Care Nova Scotia program that we launched this week to provide additional support to people in communities where we've been challenged with access to primary care. Since we launched this program on Monday, we've approached about 1,100 citizens, and over 110 have enrolled, and over 8 of those people have had their initial virtual consultations with a participating primary care provider. We expect this initiative will expand to additional communities after this pilot stage. And part of the pilot stage is evaluating this to make sure that this program is meeting the needs of our patients and that it's delivering high quality care. The last thing I want to just emphasize, one of the things that the Premier mentioned, which is we have in recent days seen an increase in case numbers in Cape Breton. We've increased our testing efforts in the area, both within our primary assessment centers, within pop-up testing. I really do want to ask, the people in the community in the Sydney area to make sure you're doing your best to get tested, to be very, very mindful of your own social distancing, of wearing masks, of just really doing your very best to reduce your own personal contacts, and certainly to go out and get tested. It's so important that we get as quickly as we can a handle on just how rapidly, if there is some additional spread in the Sydney area, and we need the public's help to help us support that. So thank you, and I'll conclude my comments there.
Thanks very much for the update. Important information for all of us, and to the patients and families. Our thoughts are with you as you fight this virus in the hospital. So we do continue to have high case counts, although they're starting to come down slowly. I don't think it'll be a surprise to most that we are still watching this very closely, and sorry to say that we are going to be extending the shutdown in the province another couple of weeks, so that'll take us to the second week of June. We need to continue to follow these restrictions, so they'll remain in place. And if we do that, then we'll be able to be in a better place come mid-June. That means our students will not be going back to school. They'll continue to use the online learning that was set up. So that means no school for the rest of the school year in the classroom. Everyone will continue to use the online learning. So to the students, I know that's difficult, that you won't be able to go back in person and see your friends. And I appreciate that that's going to be difficult. And I know that it was an adjustment to learn from distance through a computer screen, and I know that's taken a bit of a toll on parents. And to the parents, I want to thank them for staying at home and keeping their children at home and learning from home. And to our teachers, thank you for your hard work and patience. Once again, I know you've stepped up for the last couple months of the school year to help our children, and I know you're doing great work with that. To parents of the vulnerable students who have added an extra burden, we will be there to support. So we're working with the Department of Education and looking at ways that we can support you and your family through the last couple of weeks of school. To our business community, I've heard from you, and I know that it's been a challenge. You're looking for more support, and especially as we extend out this shutdown, it presents a challenge for business certainty. You're making investments. You're hoping to have a solid summer. For many of you, it's going to be the peak season, so we really want to be there to support you and have that solid summer. That's why we do think that taking strict measures now will allow us to open up sooner, as long as people listen to those restrictions. So we hear you. We're working on more support, and we'll be looking at a reopening strategy in the coming days. So bear with us, and I appreciate your patience. Just a little bit on rotational workers, and Dr. Strang will speak more to this, but I know that it's hard for you and your families, and the documentation is really important so that we have control at our border. So we want to protect you and your families, and we just need you to have that documentation. We don't want to say no to anyone coming in that needs to travel away from our province for work, and I know you need to come home for your days off to see your families. So we're trying to make this as easy as possible, and that application we're hoping is just a one-time application. So as I said, Dr. Strang will say more about that. And finally, some positive news on the vaccine front. As you would see, we're ramping up. Today will be a record day, over 21,000 doses are going into arms. So that's great work by our team. I really want to thank those involved in delivering out the vaccines and those that are getting their vaccine. We opened up to 30 and up on Monday. We plan to open up again later this week, and then finally next week to all the ages that are approved for the vaccine. And I'll be getting my vaccine next week, so I'm looking forward to that. And I encourage all those people to get out and get their vaccine. Hopefully we'll see the relatively same percentages that we're seeing in the high 80% and over 90% in some cases for our age demographics. So keep up the good work. I have confidence that Nova Scotians will continue to show up. And I'll turn it over to Dr. Strang.
Thank you, Premier. Thank you, Dr. Carr, and good afternoon, everyone. I too offer my thoughts and prayers to the two families who have lost loved ones. If we needed another reminder, this is it. This virus must be taken seriously. The new case numbers are slowly dropping, so we are making progress. We knew it would be a slow decline because of the large number of cases we uncovered when we did our surge of testing in the Halifax area. But the new case numbers continue to be too high, and the number of people in hospital continues also to be challenging. And we are seeing new cases throughout the province. That's why we're continuing the restrictions at least into the second week in June. We need to get our case numbers much further down before we can begin slowly reopening. And I'll talk more about the restrictions shortly, but I want to continue on a bit more about our epidemiology. Most of the new cases continue to be in the Halifax area, but we are concerned about Sydney, where the new cases in Eastern Zone are concentrated. There are few cases elsewhere in CBRM and the rest of Cape Breton Island, but we are beginning to see community spread in Sydney. The cases are predominantly among 20 to 30-year-olds. And so we need to increase testing to identify where the virus is in this area. And we are putting new testing options in place. So starting tomorrow, there will be a new pop-up testing at the Center 200. The Primary Assessment Center on Grand Lake Road continues to be open, offering both rapid testing on a walk-up basis and PCR testing by appointment. And the Primary Assessment Center at Northside General also offers PCR testing by appointment. People are doing a good job getting tested, or they were a couple of weeks ago, and so we need to increase that again. It's dropped off a little bit, and especially in the 20 to 30-year age group. And we need to seek out and find all the COVID that is in this area. And while our immediate priority is Sydney, we are looking at in the near future other pop-up sites within CBRM. However, there certainly is the ability for people currently who live in other parts of CBRM to come into the testing sites in Sydney that I just outlined. And also, as you become eligible for a vaccination, book it as soon as possible. And for those who are under 30, bookings will be open for you very soon. Our restrictions are geared towards reducing social activities and gatherings. That is where COVID thrives. And the traditional kickoff long weekend for spring and summer is just a few days away. This Victoria Day weekend will be very different than the ones in the past, much more like last year's. The variants make this a very different and difficult situation right now. So this long weekend cannot be the social occasion that we are used to. People cannot get together in groups, even outside. You can have a neighbor or a close friend, just one, come over to have a chat on your deck or in your yard, but you must stay physically distanced at all times, stay outside, and practice all other public health measures. If you're wondering if parks, trails, and beaches are open, they are. But you're allowed to travel to them only if they're only within your community for access. And you need to stick to just your household when you go to these places. But if you can maintain consistent physical distancing, you can meet one or two other friends. And we have been hearing lots of questions about going camping or to the cottage. Provincial campgrounds remain closed. And like we did at this time last year, private campgrounds will be open only for seasonal campers. No short-term camping will be allowed. If you are going to your cottage or seasonal campsite and staying there for the season, that's fine. A one-time trip is okay. But you have to pick whether it's your home or cabin or campsite, which one will be your single primary residence through the spring. If you're privileged to have two home options, please follow this and choose one. Many Nova Scotians are struggling right now. We need you to do your part in helping all Nova Scotians and recognize that if you're one of the few that actually have the privilege of deciding where you may want to live for the next few weeks. We are asking everyone to use their best judgment and common sense in making decisions about what to do this weekend, and to always err on the side of caution. I now want to address something we're getting lots of questions about, which is when people with 1 or 2 doses of vaccine, why can they get COVID-19? They can. We call these breakthrough infections, and actually they are to be expected. It takes 2 to 3 weeks after being vaccinated to develop full immunity to the virus. And most of the breakthrough cases that we are seeing in Nova Scotia and across the country are in people shortly after vaccination, so they haven't yet developed full immunity and may well have been exposed before they even got vaccinated. And as more of our population gets immunized, more and more cases will by nature occur in people who have been vaccinated. No vaccine is 100%, and having breakthrough cases does not at all mean that the vaccine is not working. We do know that breakthrough cases tend to have milder illness, are less contagious, and are much less likely to be hospitalized. That's why it's so important for all Nova Scotians to get their first dose of vaccine as quickly as possible. And once you're vaccinated, you cannot throw caution to the wind. It's important for everyone to keep following public health protocols after vaccination until we have a much larger percentage of the population immunized and we have the virus under much better control. We have received lots of questions and comments from rotational workers and permanent residents coming back to Nova Scotia. We want to reassure permanent residents of Nova Scotia and the rotational workers that you will be able to enter the province as long as you have appropriate approval and documentation. Starting tomorrow morning, permanent residents who apply via the Nova Scotia Safe Check-In online will not have to wait 3 days for approval. You will get an automatic approval that is conditional upon providing proof of permanent residency at our border officials. And this includes one or more of the following: a government-issued identification card, driver's license, passport or utility bill or bank statement that shows your permanent home address. So if you show up at the border and you don't have one of those documents, even if you have the automatic approval, you will be turned away. So pay attention to what the required documentation and ensure you have that with you. For rotational workers, we need you to do the full application process for your first trip back since May 14th. And when you complete your application by the Safe Check-In, you will be contacted by our border team looking for documentation showing that you are a rotational worker and the name and location of the work site. And once you have the full application, we will have a record in our files. And so for each future trip, you still need to apply, but you will get approval much faster, generally within 24 hours. I know people are tired of the restrictions. That's understandable. It's been a very hard May, as we said, for all of us. But, and we've seen it again today, COVID-19 can kill. It doesn't care about who you are, how old you are, or what you do. Since the beginning of May, 6 Nova Scotians have lost their lives because of COVID. Nova Scotians are known for buckling down and doing what is necessary to get the job done. Most of you are doing it, and now the rest of you have to do your part as well. Stay home whenever possible. Get tested, get vaccinated when you're eligible. Do it for yourself, your family, your neighbors, and your fellow Nova Scotians. Let's continue to roar back against COVID, and we will have a better summer.
Thank you, Dr. Strang. Just a reminder, we'll take one question and one follow-up from reporters on the line in the allotted time that we have for today's briefing. Just a reminder, please address your questions to either the Premier, Dr. Strang, or to Dr. Carr. We'll start with Paul Hollingsworth from CTV News. Go ahead, Paul.
Thank you, Tina, and thank you, Premier and Dr. Strang, for taking my question. Premier, you may want to answer this, or Dr. Strang, you may want to. I'm not sure who's best positioned to, but we're examining the possible timelines of these restrictions. Now, I know you just laid out the renewing of these restrictions going into the month of June, but as we try to chart out expectations and a roadmap going forward, yesterday Quebec, as you know, announced the easing of restrictions after a pretty tough 15 months. Could what happened in Quebec in any way be a jumping off point, or does it in any way inform the process in Nova Scotia of what we can expect going forward with the easing or possible easing of our restrictions here?
Maybe I'll start, and then Dr. Strang can offer more. We've been talking about the need to show light at the end of the tunnel. We just need Nova Scotians to buckle down for another, this will be 3 weeks to get to where we're putting our restrictions in place till June 9th, I believe. If people listen to those restrictions, we'll be able to have something in place, and like we did last time when we open up, it'll be a lot of caution at looking at the opposite of when we put restrictions in place. So we'll do that slowly, and it'll be based on a number of factors Dr. Strang can speak to, but every province will be a little bit different. We expect soon to come out with a strategy of reopening to provide some level of certainty, recognizing that we'll need some flexibility in that, and at a local level we can have changes in our own epidemiology. But we understand people want to see some certainty in what a summer looks like, but we need to work together to be able to get to that point soon.
So I'll add, I mean, we're looking first and foremost as to the things we put in place in Nova Scotia and how we slowly roll those back, as well as there's a lot of work we did a year ago to reopen after the first wave, which is very, very instructive. And one of the things we learned in Nova Scotia was that taking a slow, cautious approach actually paid off. Some other provinces went much faster in their reopening, and then they had a resurgence. So we're going to learn from our previous lessons. I think people can look at what are the things we have had to close down, and it's mostly around social events that we needed to close things down that brought people together, whether it was closing down retail spaces, closing down all types of entertainment, social gatherings, etc. We've had to put further restrictions on the border. So logically, those are the things that you can start to think about how we relax those, but in a very slow, incremental way.
Go ahead, Paul, with your follow-up.
I guess, Dr. Strang, maybe this is a question best directed to you or not, but CTV's been speaking with a family from Nova Scotia whose son arrived home from British Columbia. As it's been explained to us, after arriving in Halifax, they were detained at the airport hotel because they did not have the correct documentation. The family feels they were being unfairly punished. They felt they were being punished and made to feel like they'd done something wrong. Now, I know, Dr. Strang, you touched on documentation a moment ago, so this probably dips into that. But our question is the fact that they were detained in a hotel, is that a typical response, a typical protocol for a case like this?
It is, actually. So if people can, it's unfortunate, but we've done our best to make sure the requirements about who can come, and if you are allowed to come, what is the documentation you need to bring to prove certain things, that you have to have those. If people don't have them, we can't just let them move on. So that what we do is we get them, and at the airport, it's into the Alt Hotel, and they stay there until they can either bring forward the necessary documentation, or if they're not allowed in, until they can book a flight back home or to where they came from.
Next, we'll go to Elizabeth McSheffrey from Global. Go ahead, Elizabeth.
Hi there. My first question is for Dr. Strang. Wanted to ask about cottages and the long weekend. We're hearing from people that people are still going to their cottages, even though that's against the rules, if they're crossing municipalities, for example, or their communities. I'm just wondering how the province plans to enforce, cottage goers and crossing municipalities, and if they're not going to enforce that, why that rule exists. And so just sort of as a follow-up to that, what's the harm if people go straight from Halifax to their cottage in the valley without stopping anywhere or seeing anyone?
Before Dr. Strang answers, we have someone who just joined the line and they're not on mute, so I'd ask yourself to either put yourself on mute or remove yourself from the call. Go ahead, Dr. Strang.
Thank you. So I'll answer the last question first. It's about movement of people. The more movement we have, the more chance the virus goes with you. And even if you may intend to go there, what happens if you get in an automobile accident or your car breaks down? There's lots of things. I think people should recognize that if they actually have a cottage or a second place to go, they are extremely privileged. There are many people that are struggling to maintain their home, losing their jobs right now. So if you have a second home, choose one of your homes and make that their permanent residence for the next few months. Do not go back and forth. That's not very much to ask when many people are struggling for a lot more. We have people struggling for their lives in hospital. So choose one place and stay there. I may sound frustrated, but I am. That is an extremely privileged position to be in, and recognize that privilege.
Go ahead, Elizabeth. Oh, sorry, go ahead.
Don't enforce our way out of this. It's like everything else. Do the right thing because it's the right thing to care for each other. Recognize how privileged you are and do make the right choice.
Go ahead, Elizabeth, with your follow-up.
Thanks very much for that answer, Dr. Strang. My next question, I guess, would be for the Premier regarding rotational workers. we're hearing lots of issues with the documentation. Some rotational workers run their own company, for example, and there's no one else who can sign a letter other than themselves saying that they're rotational workers and this is their shift. Other rotational workers don't have set rotations because their jobs are client-based or needs-based, and they're running into problems with the system. They're being told they should apply as permanent residents instead, for example. I'm just wondering what the detailed plan is to address these sorts of challenges that are arising from the documentation requirement.
Yeah, so I think Dr. Strang went over the details of how we're trying to accommodate the most that we can. We have to protect the integrity of our compliance at the border. And so we have had instances where people have tried to get in dishonestly. And we need to make sure that we have some level of documentation. It doesn't have to be a letter from their employer, but they have to provide something so that we can protect Nova Scotians. And Dr. Strang, you want to?
Yeah, and then so exactly we're expanding. You know, we initially we're broadening out. It's not just a letter from your employer, but anything that's satisfactory to say that you're a rotational worker. The rotational worker protocols are for people who go back and forth on a fairly set schedule. We have another stream. If people travel periodically because of their work in and out of the province, but it's not on a set rotation, there's whole other protocols, and they still have to apply and go through a different process. They're sporadic, unscheduled kind of trips back and forth are not the rotational workers. There's a different stream for those type of workers.
Next, we'll go to Jean Laroche from CBC. Go ahead, Jean.
Good afternoon. My question is for Dr. Carr, and it relates to the, you made allusion to it, it was the COVID patient or the patient who was tested COVID in the hospital. If memory serves, and correct me if I'm wrong, the original plan was to test 20 patients who had been around that one patient. You've said now that 15 of those have tested positive. Can you kind of let us know, are these all people who are on the same unit, on the same floor, or is it throughout the hospital? I just need to get a better picture of what happened there and how the spread occurred.
Sure. So my understanding is that the unit is actually a 36-bed unit. That there was a positive patient, so we tested all of the other patients on the unit, and from that entire unit, we've identified a total of 15 positive patients now. We have also, as of this morning, swabbed virtually every patient at the Halifax Infirmary. Their testing might not all be complete, but as of this morning, there were no further positives on the Halifax Infirmary site, just generally amongst our patients. And we will continue to swab all patients at the Victoria General site of the QE2 and the Dartmouth General in the next few days.
Go ahead, Jean, with your follow-up.
And this one is for the Premier. Mr. Rankin, you talked about a plan for school for vulnerable children. Can you kind of let us know what you mean by vulnerable children? And you said that there's some sort of plan in the works to, correct me if I'm wrong again, to bring them back into school. What is the plan for those people?
Yeah, no, it wouldn't be bringing people physically back into school. It's just recognizing that there are families that would require more support. So we've asked the Department of Education to collaborate with community services, determine what type of programming, what type of financial resources are required to ensure that we have those supports for families that could be disproportionately impacted by not being able to go to the school environment.
Next, we'll go to Nabal Snan from the Chronicle Herald. Go ahead, Nabal.
Good afternoon. Dr. Strang, the province has previously indicated that temporary foreign workers will be prioritized to receive a vaccine during phase 2 of the rollout, but instead they've been getting the vaccine based on age, like other people in the province. So advocates are wondering if you can provide some clarity on the discrepancy.
So we've said for all groups that it's not their priority on their occupation, it's about access. So we're making sure that the temporary foreign workers are available to have access to vaccine, like all other people who are in the province, and it's primarily based on age.
Go ahead, Nabal, with your follow-up.
Thank you for that. And this question is also for Dr. Strang. Dr. Strang, do you have any insight into why the testing uptake in Sydney is below its capacity? Do you know what is needed to get people to get tested?
I don't have any insight of that. I mean, that's I think we have good access to testing in that area. We continue to expand the access to testing. As I said, we're opening up Centre 200. We have had it previously at the Member 2 Centre as well, and we're also looking at making sure that in the coming days we have some pop-up testing in other communities that are part of Industrial Cape Breton or CBRM. So I think we've got good access. We continue to use our local communication messages. The Nova Scotia Health is pushing out messages. We are, as government, working with local media. So I hope everybody, especially in the Sydney area, is hearing this. And we really need people to come out and get tested, especially in this age group, the 20 to 30-year-olds, where we're seeing most of the concerning cases and the spread within the community. It's vital that we get people tested so we can identify any additional cases early on and do the isolation of cases and identification and quarantining of contacts.
Next, we'll go to Lindsay Armstrong from all Nova Scotia. Go ahead, Lindsay.
Thank you. A question for the Premier. I'd like to hear a little more about our future reopening plans. You've said that something will be coming. I'm wondering what more details we might be able to get. Saskatchewan and Quebec have both released reopening plans, and PEI has said it's working towards family reunification. I'm wondering at what stage do you expect to share Nova Scotia's plan publicly, and what sort of flexible parameters will be involved in this broad reopening plan?
Yeah, so this is something I think that especially our small businesses are eager to have a glimpse of to what the summer is going to look like. We want to make sure that we have flexibility with whatever strategy we come out with. We want to be able to tell Nova Scotians if the restrictions, if people listen to them, where we think we'll be in late June to early July. So I would say within a week or so we should have a little bit more details on that, but recognizing that we need to have flexibility for public health to continue to monitor our cases and the uptake of our vaccines.
Go ahead with your follow-up, Lindsay.
Thank you. I'm wondering about vaccine capacity. A question for Dr. Strang. Premier Rankin, this morning you noted on Twitter that we expect to vaccinate more than 2,000 people today. I'm wondering if this pace is something we can keep up, and if the province is looking at weekend clinics, after-hours clinics, and things like that to further increase our vaccine capacity.
So it's 20,000 doses of vaccine we're delivering today. So we already have weekend clinics. We have, especially through our pharmacies, we have extended hours throughout the day, early morning into the evening. We always match up the vaccine that we have available to the appointments, and we spread them across locations, across time frames, throughout the 7 days of a week. What people may not still recognize, they say, well, we get towards the end of a week and we're not doing as much vaccination. That's simply a fact that that's the amount of vaccine we have left to do as we get towards the end of our supply. We have a very flexible vaccine program that if we somehow get more supply, we can very quickly open up the number of appointments across the province by extending hours and doing what you're suggesting. But we do not have vaccine sitting around that's been delayed getting into people's arms. We create a schedule of vaccine based on our supply, and that is looked at twice a day within the certainty of our guaranteed vaccine supply. So we're very flexible and nimble, but always within, we can't give vaccine that we don't have.
Next, we'll go to Adrien Blanc, Radio-Canada. Go ahead, Adrian.
Thank you. Dr. Strang, I think you said that in the Cape Breton area, the new cases were mainly 20 and 30-year-old people. Is it younger than the average in the province, or could you give an explanation?
We're not sure. Yeah, it is the 20 to 30-year-olds. That's where we're seeing a concentration of cases. There are some in other ages, but often they're explainable by some sort of travel or their close contact of other cases. But what we're seeing most concerning is this concentration in 20, 30-year-olds, which seems to be local transmission. We have not had that kind of a concentration within a very specific age group in other parts of the province.
Go ahead, Adrian, with your follow-up.
Are you considering reopening some regions before the others in the province?
Sure.
I think we have to look at things where right now, given where we're at with our case numbers and the pressures on the hospital, we have to have a provincial approach. If we're able to get things under control in the next couple of weeks, especially in the Cape Breton area, we started this whole journey by having restrictions in the Halifax area, which we then had to quickly move to make province-wide. So it is possible that we may be able to become less restrictive outside of Central Zone, given the epidemiology, but we're not at that point yet. So that's something we have. There's no final decision made. It's not something we'd take say for sure or take it off the table for sure. It's always something we're looking at based on is there a regional way to look at the epidemiology, but we always have to be concerned that even if there's a higher rate of virus transmission in one part of the province, there's always a risk that could get taken elsewhere.
Next, we'll go to Zane Woodford from the Halifax Examiner. Go ahead, Zane.
Thank you. This question is for either Premier Rankin or Dr. Strang. On childcare centres, are you extending the 60% capacity requirement along with the restrictions till mid-June?
So we continue to work with the childcare sector. We haven't mandated any capacity, but we continue to work with them with a target of 60%, and the vast majority just have naturally had 60% or less. There's a very small number that we've had to help move some kids around to keep them in that 60%. So we'll continue to work with that childcare sector on making sure we have within that 60% range to decrease the overall risk within any child care center.
Go ahead, Zane, with your follow-up.
Thank you. And for Premier Rankin, we're hearing from at least one child care center that they're just finally getting paid, in the next 24 hours. But it's just a tiny portion of what they usually bring in from parent fees. So what is your government doing to make sure that these centers can actually remain open for essential workers' children? And what's causing this delay with payment?
So I don't have information on the timing. I know the department is working with the sector to get the funding that we allocated for this out as soon as we possibly can. My understanding is there has been some money already out the door, and we'll continue to work through that. And what we provided was enough to cover the spot in the healthcare center, but not the profit margin. So this would be to ensure that it kept them the placement of those spots that have been removed from if their children are being kept home, that we would provide enough funding at the cost level, but not including what the profit would be on top of that.
Next, we'll go to Victoria Walton from the Coast. Go ahead, Victoria.
Thanks. This is a question for Dr. Strang. I'm wondering if you can tell us about the expected amount of Pfizer and Moderna. That's something that we really haven't heard a lot about in recent weeks. I know previously there were updates from the government, but now our capacity and the amount has increased so much. As we said, we're doing 20,000 today, but I'm just wondering kind of on a weekly basis or in the next 2 weeks how much more we're expecting.
I don't have the firm numbers. We're looking at possibly doing a more detailed update next week on the vaccine program. But we still are, we're certainly expecting we're in the position now, much stronger supplies of Pfizer vaccine, especially throughout the months of June. And we're hearing good news about even into more than we expected in July.
Go ahead with your follow-up, Victoria.
Thanks. And this is a question for Dr. Carr, if he's still there. I'm wondering about healthcare workers, if he can give any indication of what percentage of healthcare workers at the NSHA or any, have been vaccinated, whether it's 1 or 2 doses. and if there's any breakdown of that by age group. For example, have younger healthcare workers, there's a lot of nurses who are and CCAs who are younger in their early 20s, age groups that haven't opened yet. Are those people already vaccinated as healthcare workers, or will they be waiting just for next week for their age group to open up?
Thank you for your question. So since December, healthcare workers have been prioritized as part of our provincial vaccine strategy. And I think somewhere in the vicinity of 43,000 vaccine appointments have been booked for healthcare workers. It has been an age-based program. But they have been prioritized early in the phase, and we continue to make vaccines available to our workers. I can't give you the breakdown by age cluster. We don't. The choice to be vaccinated is a personal choice, and we don't collect that information. But I can tell you that there have been 43,000 appointments for healthcare workers vaccinations. That would include hospital staff as well as community-based workers through our program.
Next, we'll go to Pat Healy from the Laker. Go ahead, Pat.
Hi. This question's for Dr. Strang and Premier Rankin. The number of calls to the mental health crisis line was up 1,443 calls this March and April, the third wave, compared to the same 2-month period in the year before the pandemic. What messaging of hope that things will be okay can you give to those who are struggling with the restrictions and the impact of the third wave on them?
So I know it's tough, and we're asking for everyone to buckle down for another 3 weeks. But this is what we need to do so that we're able to get out of this sooner. It's a challenge on many people, and we recognize that it impacts some more than others. And we know people are struggling with mental health and addictions across the province. We're going to continue to provide support where we can. There's been a number of organizations that received funding over the last couple of days. We're going to continue to work with our teams to get the funding out there to support Nova Scotians. There are helplines, as you mentioned, that they can reach out to. But I will say this, we are optimistic that we will get through this together.
Go ahead, Pat, with your follow-up.
This question's for Dr. Strang. What does a more open summer look like? Can organizations plan events with reduced capacity? Can balls, football, rugby, and soccer leagues gear up for their seasons?
So I think that's part of what we're going to see more as we start to talk in more detail about the reopening plan. I think you've heard at a national level people talking about as we start to open up. The first thing is remembering that outdoor activities will be much safer than indoor activities. So things will be less restrictive if they're outdoors rather than indoors. But we're still going to have to stay in relatively small groups throughout the summer. But we are looking at how we can open up a whole range of activities, including sports, arts, and culture activities, but doing that in a way that is the required level of safety based on the virus epidemiology and the level of uptake of vaccine.
And that's all the time we have for questions. Go ahead, Premier.
Thank you. While our cases continue to come down, and that's a positive thing, we're nowhere close to being out of the woods yet. It's not time to let up, not while we have people dying from this virus, not while we have now over 100 people in the hospital, and not while we have community spread in 2 of our major municipalities. This is exactly the time to stay committed to the protocols and follow the restrictions. I know that this is difficult. You've worked so hard over the last number of weeks to control the spread, and our cases are coming down, but we're not where we need to be yet. So we're asking you to lock it down a little longer. These next 3 weeks are critical. We all want to open up and have a good summer. We just need to make sure that we continue to follow the protocol, and we're starting to put a plan together to what it looks like in the summer. So stay strong and stay together and stay the course.